In a public health emergency, every second counts. The purpose of a point of dispensing site, or POD, is to provide medication, vaccine, or other supplies to a large number of people in a short period of time. As a public health professional or volunteer, you are being asked to help in this important effort. Your role in this response is essential. The more people we can provide medicine to in the shortest amount of time, the more people we may be able to prevent from getting sick or even dying. We thank you for your willingness to serve. The purpose of this training is to make you familiar with what a POD is and how it functions. Please pay close attention to the information and instructions you are about to receive. Following this video, you'll be given training specific to the job you will be doing in the POD. If you have any questions, please make sure you ask a supervisor. Let's begin by explaining what a POD is and what it isn't. As we mentioned before, the purpose of a point of dispensing site, or POD, is to quickly distribute medication, vaccine, or other supplies in the event of a public health emergency. In some cases, like an anthrax event, medications may need to be given to people within 48 hours. The goal is to make sure that everyone who needs the medication can get it. A POD is not a hospital or a place to treat people who are sick. People who are sick will be asked to stay away from the POD and to go to a hospital or healthcare provider instead. There are two basic types of PODs, a walk-through or a drive-through. In a walk-through POD, people park and walk through the process. Walk-through PODs are often set up in a public building such as a school, gymnasium, or auditorium, where there is space for large numbers of people to easily come and go. In a drive-through POD, patients remain in their vehicle and are directed through the site. Drive-through PODs are usually held in a large parking lot where there is room for cars to maneuver. The design, size, and location of any particular POD will depend on the number of exposed people and many other factors. Depending on the nature of the incident, weather conditions, and other factors, the POD may be indoors or outdoors. For very large events, when hundreds or even thousands of people may need to be given medicine or vaccine, the POD may operate 24 hours a day. It may last for days or even weeks. Now let's look at how a POD is organized. There are 4 general stations in a POD operation: reception, assessment, dispensing, Q&A, and exit. At some PODs there may be 2 additional stations: acute care and observation. From start to finish, the process works like this. When clients first enter the POD, they will receive a general health screening or triage. If sick or having any symptoms of the disease agent, the person will be referred to a medical evaluation or to their private physician. They will not be allowed to enter the POD. Clients in need of first aid will be sent to acute care. If the person has special needs, such as a visual or hearing impairment or disability that requires a wheelchair, they may be moved to the special needs area. Here there will be people to help them through the process. Most people will not be sick or have special needs. They will enter the POD and proceed to the first station, which is reception. At the reception station, clients will be given a general description of what happens at each station and a medical form to complete. On the form, the client will provide their name and contact information, as well as some basic medical information. The client will also indicate if he or she is picking up medicine for other members of the household. A forms checker will quickly check to make sure the form has been filled out completely and legibly. Once the forms have been completed, the client will proceed to the next station, which is assessment. The forms will be reviewed to determine which medicine to give and to check for any allergy or contraindications. From the assessment station, the client will proceed to dispensing. At the dispensing station, clients will be given medicine or vaccinations that will prevent them from getting ill. After receiving medications for themselves and their families, clients will turn in their form and exit the POD. If clients have questions before they leave, they can get them answered at the Q&A station, which will be located near the exit. Once again, for most clients, this will be a very simple 4-step process. Clients will be greeted and asked to complete forms. Forms will be reviewed for completeness and legibility. Medicine will be given. Clients will turn in their forms and exit the pod. For those with special medical needs or for those with allergies or contraindications to certain medicines, there may be additional steps. For example, clients with complex medical conditions may need a more comprehensive assessment to identify the correct medications to dispense. In some pod operations, clients that get a shot may need to remain on site to make sure they are okay. There will be good signage throughout the pod to designate the location and function of each station using simple terminology. Now let's take a look at the staffing of a pod. Each pod site will have a pod director responsible for the overall pod operations. That person is the primary on-site decision maker. Under the pod director, there are 4 main groups or teams: medical group, support group, safety group, security group. The medical group is composed of the staff who greets the clients, assists them in filling out the forms, determine which medications to give, provide acute care and observation if needed, give the medications or vaccinations, and answer questions. The support group supports the operation of the pod and are given a variety of tasks, including managing all the necessary equipment needed at the pod. They'll make sure each station or area is supplied with everything it needs and will resupply as requested. The safety group is composed of volunteers who assist with traffic and crowd control. They'll help direct people through the pod and watch for any unsafe or disruptive behavior. The security group is made up of officers from the Allen County Sheriff's Department and Fort Wayne Police Department. Their job is to protect the staff working the pod and to keep the peace inside and outside the pod. The size and scale of a pod is flexible so that it can adapt to the needs of many types of public health emergencies. Not all positions or stations will be filled for every pod. As a public health worker or volunteer, you will be assigned to one of these groups and given a specific job based on your profession, your skills, or your prior experience. You'll also be given a job action sheet which explains your duties. Following this video, you'll also be receiving training specific to your position. As a member of the Public Health Response Team, you will also be given medicines for yourself as well as for any family members living in your household. You may be given personal protective equipment, or PPE, such as masks or gloves, which you will be asked to wear. Remember that at the pod, you will be helping to provide medicines or vaccines which could help keep people from getting sick or even dying. Once again, our number 1 priority is to provide medications and good public health care as quickly and efficiently as possible. Do your best to communicate quickly and keep the lines moving. A public health emergency could be a very stressful experience. Some clients may need help coping with anxiety. If you are assisting a client and they are having trouble, you can call for assistance from mental health workers who will be at the pod. If you notice someone is behaving in an unsafe or unlawful manner, you can also call on a member of the safety or security teams to assist. While you're busy taking care of the clients, don't forget to take care of yourself. Remember to take food and water breaks as directed. Be sure to tell your supervisor if you are having any difficulties. Wear comfortable clothing. Keep personal items to a minimum. Pay attention to your surroundings. Follow the check-in and check-out procedures. Let your supervisor know of any problems or call the safety and security team if help is needed. Be sure to follow the procedures for checking in and out at the start and end of every shift. And never leave your station without letting your supervisor know. If you are approached by a member of the news media, alert your supervisor and direct them to the Public Information Officer on scene or the Joint Information Center if one has been established. Remember that some of the information in these videos is likely to change from site to site or event to event, so always listen to your supervisor for event-specific information. Thank you for your time and attention. You will now proceed to the next phase of training.